Well, the name of the project is PositivMasc, and the idea for this project is to identify uh, what are the types of anti-violence masculinities in 4 different countries, in Sweden, where I'm located, in Spain, in Ireland, and in Israel, and to compare the different masculinities across settings. That is one of the main aims, but also to try to understand how these different understandings of the different ways that people talk about violence and masculinities, how do they, how that influences the way that people react when they see violence, right? So, for example, if
Yes.
you see that something is happening, are you going to react? Are you going to do something? And if you're going to do something, what is that something that you plan to do? So that's one part of the project, but the other part that we think is also very important is how can we promote and support those men who are enacting anti-violence masculinities? And why do we think this is important, for example? Because we sometimes we take for granted that everyone is against violence against women. Maybe, but how is violence against women defined? How do you
Yeah.
understand that? And what do you do? And how do you promote this way of thinking in society across different groups? This way, new way of, well, not certainly new, but a way of being a man that that goes away from the traditional macho construction that is it could be prevalent in more societies than others, but still where violence is somehow glorified as a violent way to deal with your emotions, for example, or to deal with
Yes.
conflict, especially in violence against women. But we also seek to identify once how to promote this way of thinking, but also how to support men who have this anti-violence stance. And we think that it is very important, basically because, uh, especially among young men, you will have it is likely that if you have an anti-violence stance, then your group of peers may not have that anti-violence stance. Let's
Yes.
give an example. If you disagree that that, for example, online porn, which is or online sharing of nude pictures of women, right?
Mm-hmm.
Which can be as a forms of violence that have become more and more common recently with the development of technologies, right? If you disagree with that, and then let's say you are in a locker room, the locker room talk, and your peers are showing pictures of naked women, and then you say, "Hey, that is not right," you know.
Okay. Yes.
So you may face a lot of backlash from your peers, especially when you are a young man. Like, oh, don't be the guy who is spoiling the fun and so on. So that peer pressure to conform to these traditional macho norms may be in some cases too much for you.
Yes.
So how do we support those men who are daring to challenge the status quo, for example? What can we do to support them? Because this is a behavior, you know, and as any other behavior, if you don't have a supportive environment, then it might revert, it might go back. This is something that we have been learning from studies all over the world, from our studies in Nicaragua, for example. We have published
Yes.
a
Okay.
couple of papers on that. And we asked the same question to Nicaraguan young men. So what is violence, and how do we deal with violence? And what we found is that there are different discourses, there are different ways of
Yeah.
reacting to violence. From, and this is talking from the Nicaraguan experience, from that paper that is already published, from one discourse that was the traditional macho discourse, like, you know, it's not my fault. Women sometimes make me angry, so if they make me angry, it's their fault and they make me angry. So it's not my responsibility. It's their
Mm-hmm.
responsibility. They shouldn't make me angry. When we talk about violence, physical violence or sexual violence,
Yes.
then you have this ambiguous discourse. Then that they say, okay, no, it's a shared responsibility. As a man, I should be able to control myself, but also sometimes women push too much.
Okay.
And then you have another discourse, which is a discourse that is on the completely opposite, that says, no, it's regardless of what is happening, it's men's responsibility. You should be able to control yourself and not to react violently too. situations.
Okay.
So from that experience, we identify that there are different ways of conceptualizing responsibility in terms of
Absolutely. Yeah.
violence, and then how do you, so if you want to facilitate change, then you need to understand what is already there, right? What are the gaps? How can you develop intervention programs to change the way of thinking into a way of thinking that goes away from my point of view, from this ambiguity, and which in that case was the dominant discourse in the Nicaraguan setting. So that was kind of this inspiration from for this multi-country project to kind of figure out how are we doing here? What are the types of masculinities they are? Are there any anti-violence masculinity? In it, so there is a variation in these anti-violence masculinities in the terms of how violence is identified.
Yes.
Define what is violence for you as a man.
Okay.
How do we where do we assign the responsibility for the violence? Is it shared responsibility as we saw in Latin America? Is it man? Is it women? And whom? And but also, what do you do when you see something? You know, when you see something happening, when you see your friend, for example, in a pub that is approaching a woman that is drunk and kind of trying to take advantage of that situation. What do you do?
Yes.
If you as a man see your friend doing that, but if you as a man see someone else doing that, or and yeah, we try to explore what do you do in those situations, and
Okay.
yeah, so and that it gives you, we think that it's going to give you a lot of information to design interventions, because you need to identify what are the gaps.
Absolutely. Okay.
And that is very important, and also it's very important to involve men, because in violence against women prevention, it's paramount to work with women. We need to empower women, provide services, but you also have to work with the perpetrators. And then the perpetrator, but in men in general, because if you are not violent yourself, but you are not critical, at least this is our sign, if you are not critical to the violence of others, then to some extent you are supporting the violence of others, right? You don't need to be violent yourself if your girlfriend knows that if she goes outside wearing leggings, she may be harassed.
Yes.
So you don't need to tell her, don't wear that clothes, because she already knows.
Yeah.
Because
So the idea is to
outside in society will make her sure. So to some extent, men who are not violent, but also are not critical of this society and don't react to that, then they benefit from these behaviors, even if they are not violent themselves. That is a very good question, and honestly, we are conducting a study on that, but I don't have the data to support what I'm going to say. But in general, my perception is that there is an institutional gap. There is a lack of in general, not only in these 4 countries, but in many countries around the world, how to work with men, how to address these issues of masculinity, for example, masculinity in relationship to violence. It's not there as we would like to see it as much, because we need to work with men. Of course, this is it's a very careful balance when you have not many resources, where to put the resources, right? Yes. But I think in an ideal world, if you have the resources, you should be able to work both with men and with women, because working only on one side of the equation is not going to give you that much change as you will expect if you work with both of them, both men and with women. And also, perhaps what I'm saying is that sometimes there is, when you're working with men, there is the men are being portrayed as the bad guys, right? And in a way that may be counterproductive. That may not be the right way to approach this. Not as the enemies, but as people who may want to change. And not all men are violent. That's a fact that we know that. But to promote this kind of thinking, it's I think it's very, very important. Not take it for granted, not to assume that because someone is against violence, this means that what is violence for this person first, what type of violence, where, from whom. but also that people will act. And we strongly think that acting is key. If you see something happening and you do nothing, then you are anti-violence. So what good is to be anti-violence if you do nothing? And that nothing, that something could be from calling the police, calling the authorities, just say, hey, just intervene without saying, hey, this is wrong, or something can be done. Something can be done. It doesn't have to be always intervening with force or whatever. No, not at all. But as long as you do something. And to change also this idea that violence against women, especially interpersonal violence, is something private. It's an issue between couples or between two people. No, this is a public health issue that we should intervene always. I mean, that's or stand from a public health perspective to move this into, for people to realize that this is a public health perspective. It's not a conflict, just only a conflict between two people.
Yes.
So, because that is an argument that is often used like, oh, it's their problem, right? No, I don't want to get into that because it's their problem. No, it's not their problem. It's society's problem. Well, or data collection or the overall project design is based on a combination of both qualitative and quantitative findings. So we start with a qualitative study because we want to identify what are the types of masculinities there, how do they relate to acting and all the things I have been talking about, but also what are the strategies to support and to promote anti-violence masculinities in different settings. So, and why do we start with qualitative? Because that is not known. So we want to identify this to be able in the second stage that we are now, in order to be able to quantify the strategies for promoting and supporting. So we identify that in the first stage, and then we can quantify that in the second stage. So in the first stage, we use in-depth interviews and focus group discussions with different people. We talk with young men.
That's another dimension of your,
yes,
theoretical frame, the young men.
Young men and actually it's young people, young men and young women, because we also believe that it's very important to involve young women regarding this question. So we identify young men, young women, and stakeholders in different countries. And within the young men and young women, we wanted to try to explore if there was any difference in regarding the understanding of violence against women by those who are, from the general population, and those who have been part of some movements in their countries that are promoting, new ways of being a man and that are rejecting violence against women. So we wanted to see and we wanted to compare if there are any difference in the way that people think, yes or no, and so what are the differences. But at this stage, we are analyzing the qualitative data. We have some interesting findings.
Yes.
But these are preliminary findings. So, but what we are seeing is that there is a difference in the way that young people, that young men, in this case, young men, because we are looking at the data from young men, conceptualize violence for most. There is, sexual, physical is violence, but from others, the emotional violence and controlling behavior are not perceived as violence in itself. So that's a preliminary finding that gives you an idea of where can you develop interventions, for example.
Yeah, absolutely. Because that's one of your guidelines, right? To prepare some future interventions.
Absolutely, and to have educational materials where we see what and to promote discussion, what is really violence, because then the more limited your definition of violence is, then the less likely that you will act, or perhaps you are not aware that you are being violent yourself. So that is one variation that we found, but we found a variation in terms of sexual violence, at least in the Swedish data. How do people see consent and sexual violence? And this definition of a very blurry, very blurry arena where when we talk about consent and sex, for example. Whereas others are more clear that only yes means a yes. Right?
Yes, absolutely.
So we see variation in that, and also we are seeing a variation in how do people react to violence. What do they do when they see violence? And we use specific vignettes describing different if hypothetical situations. Like, you know, if you see your friends, like the one that I'm talking about, if you see your friend in a club that is approaching a woman that seems to be drunk and he seems to take her somewhere else, but she doesn't seem to want, but she's quite drunk. So what would you do? So in those cases, we are exploring what men and women, all the stakeholders will do when you see it, to see if there is any variation in the way that people react to that, and what are the arguments to that reaction. So if you do nothing, why? If you do something, why?
Okay.
And
And
we
are
are,
your focus group mixed? Like, do they mix men and women, or is it like separate groups?
no, it's separate
Okay.
focus group discussion with young men and young women, because there are sometimes, you know, this is methodological. There are power relationships that may be there in different countries where young women may not feel comfortable to talk openly about things, and the same with men as well. So we keep them separated.
Okay.
It has had an impact. I mean, data collection has become more difficult, especially for the qualitative data collection. And also delay the whole thing because where countries are closed and you cannot collect that. That is a fact. So we have been delayed in that sense. And also the good thing about having Zoom is that now we are able to communicate with the country partners. I mean, always has been like that, but it became like a life-saving situation because we have planned meetings where we were going to discuss or face-to-face meetings where we were going live meetings where we were going to discuss or results and so on, but we have to, you know, scrap those plans because it was not possible to travel. So it has had an impact, and now we are kind of trying to adjust to that. In this autumn, we're going to start the quantitative data collection, which is through a questionnaire, but we are using an online tool that hopefully will facilitate this data collection. So we'll see. It's a little bit tricky to adjust to this situation and the changing guidelines. But if I might add something here, I think, and not only for the project, but the influence that COVID has had on violence against women in general, what the empiric evidence shows is that, this is the first report, is that violence against women has been increasing.
Yes.
In these times, and basically because men who are violent may be spending more time at home. They are spending more time at home, and that might create more opportunities for conflict, for example, and also more stress related to COVID and this overall situation, but losing your jobs and so on, that will generate more. So I was thinking that one of the key findings that we got from the qualitative studies, that one suggestion was to help men to learn how to control their emotions. And I think that is very, very important for everyone, but also for men who are violent. How do you react to frustration, for example, and anger?
Yes.
I mean, that was something that it was highlighted by many informants in the qualitative studies, and that may be related quite a lot in this situation where people are very stressed. You can become very angry because you have lost your job, and you can become very frustrated. And how do you deal with those emotions?
Yes, absolutely.
That it doesn't transform into, you know, violent situations with your partners or with your partners, but also with other women in general and other men, of course. So how do you deal with that? I think that is very important because men are not, as I would say, in general, I will dare to say that, but we are not aware of how to deal with our emotions.
Yes, this is part of the socialization. That is
the socialization, right? I mean, how do you deal with your emotion in a healthy way? It's something that I believe that interventions can do more to help us men to deal with emotions in a more healthy way.
Okay.
But I also would like to say, and I don't know if I'm taking too much, but also would like to say that this is a multi-country study, and we have fantastic people from these 4 countries. I just wanted to highlight my other collaborators here because it's not something that it's been done only by us at Sweden, as and I work at Karolinska Institute in the Department of Global Public Health. But also we have our colleagues from Ireland, Dr. Claire Edwards, who works at the University College Cork in Ireland, who is a sociologist.
Yes.
But also have an extensive experience dealing with policy issues and violence against women. We also have Dr. Nihaya Daoud from Israel, from Ben Gurion University in Israel, who is a social epidemiologist.
Okay.
And we have Dr. Carmen Vives Cases from Alicante University, who is a sociologist, but also, let me see here, a master in public health, and also he has a PhD in public health. So, our staff or collaborators are very highly trained in how to conduct research in a sound way, but also we have different theoretical backgrounds and different backgrounds, which actually it makes a good complement to the skills that we have from each other. And this project couldn't be done without these fantastic collaborators from all the other countries. They are really, really good. So we are really enjoying this collaboration.